Hello friends, hair loss is such an important problem these days and a lot of people across the globe face this problem. And sometimes you get confused and there are so many options available on internet, so much of information that it confuses you. So this video I'm making deliberately to clear all the doubts, all the confusions which you might have, all the problems which you might be facing, all the questions, or even those questions which haven't even arisen in your mind. I'm your friend Dr. Shail Gupta and I've been practicing for almost 2 decades. So hair transplantation is a very important part of a treatment program which we have for. So as far as treatments of hair loss are concerned, there are 3 treatments. One is medical treatments where we give medications, and main medicines involve minoxidil, finasteride, biotin. There are some supplements also available. I have made separate videos on minoxidil, finasteride. Go through the videos, they are very informative. The links are given in description and these are wonderful videos. Then there is a treatment called platelet rich plasma or PRP, which is again very helpful. Lot of videos I have made on platelet rich plasma. There is a lot of confusing information about PRP. I have given the links in description. Go through the videos are very genuine and good and they'll clear your doubts about PRP or platelet rich plasma. Now the third and most important solution, which is in fact the only solution in many cases, is hair transplantation or hair restoration. As far as restoration of hair is concerned, it can be a natural hair transplant, it can be artificial hair implant. It is a kind of a camouflage which we do on your scalp. There are some methods like scalp micropigmentation, and at times we combine these procedures to achieve optimal results. There is another technique called hair weaving or a patch which is fixed on the scalp. It can be used in toto, or we can use it partially, like creating the hairline in front and then covering the rest of the area by doing a patch. So there are so many options, and obviously every person is different, their needs are different, their expectations are different, their past was different, their future is going to be different. So according to their personality or availability of donor, progression of disease, we have to customize this solution. I'm repeating this, we have to customize this solution. Now, in my practice, over a period of time, I have noticed that the cases of repair or botched up transplants are on a rise. And during last couple of years, I have noticed a rapid rise in the number of repair transplants coming to me. The reason is obvious. The procedure is getting popular across the globe. There are so many places in India also where it is being done, not even by doctors, but by it is getting done even in salons and so many other places. So the reason why I'm making these videos is to educate you so that you know the facts about it. And there is a lot of information available on internet which sometimes can be confusing. Rather, most of the times it is confusing because there are different people claiming different things. There are guys who are selling things. There are people who have got their transplants done and they are promoting and whatever. I mean, there are so many commercial interests involved in the information, seemingly harmless, free of cost information reaching you. But you have to analyze it and let only that information enter your subconscious, which is going to be useful in deciding, in taking a decision, a correct decision for your problem, for your issue. And this video is especially for my Dutch friends. Hi Netherlands. As far as methods of hair restoration are concerned, there are 2 methods, FUT and FUE. Initially, when I started my practice around 2001, there was only one technique. In fact, that time there was punch graft, which was like, dying its own natural death. And that time follicular unit transplant or FUT had come into picture. And those days we used to see a lot of cases with punch repair, punch grafts, uh, with a typical pedifield appearance. Now time changed, follicular unit transplant or FUT surgery evolved over a period of times. Initially when we started doing it, like the results were not that good, and obviously the instrumentation, technique, knowledge, experience, everything counted. And eventually next 5, 6, 7 years we mastered the art of follicular unit transplant. And obviously it is a continuous improvement which goes on. I'm still learning. Then came FUE into picture. So FUT, believe me, needs a lot of teamwork, effort, patience. At times I thought of giving up, and because of so many things. But then it was, I think, passion which kept me on, and I just kept on doing it and improving it. And eventually when FUE was introduced, I also learned it and started doing it and found it to be easy, much easier than FUT. And then over a period of time, FUE gained so much of popularity because of the fact that it is easy, doesn't need a lot of surgical training, experience, expertise. Doctors come to me for learning the art of hair restoration. I teach them, and for a lot of time now, I see for past maybe around 7, 8 years, nobody comes to learn FUT because it is time consuming, and they have to stay here for long, and it is like a big surgery, and not everybody is really keen to do this. In fact, most of the doctors, they come for FUE only. And what I have noticed over a period of time, there are doctors who know how to do FUT. They were doing FUT, but now they have completely shifted their focus on FUE. And it is quite obvious and very easy to understand that if somebody is not doing a particular method, they will point out negatives in the other and all the reasons, all the excuses in the world not to do a particular method. Now, when I see a patient, I think in the interest of my patient, what is going to be most useful for this particular guy. I have made a series of videos on the differences between FUT and FUE. If you haven't seen those videos, please go through those videos. They are amazing, loads of information there, and that kind of information which you are not going to get anywhere else. For example, I've seen people with grade 6, grade 7 doing only FUE, knowing very well that we are born with a limited donor area. Both the techniques are good, and suppose if you see, this is the permanent donor zone, the image which you are seeing, and if I try to extract all the grafts from this area by FUE, can I do that? And what will it lead to? It will lead to a huge gap in that area because we are extracting grafts and that area is now empty. We are creating gaps in the donor area by extracting these grafts by FUE method. Now, if I do FUT, I just put stitches to close the gap, and you end up having a thin fine line. The elasticity of skin usually allows me to take FUT 2 to 3 times in most of the patients. At least 2 FUT surgeries are pretty much on the cards in most of these cases. However, there are some cases where we cannot even do 1 FUT surgery because the skin over here is pretty tight. So that is why we emphasize the importance of in-person physical consultation with your operating surgeon so that this can be assessed. In fact, what happens, I have seen people coming to me and inquiring about their hair condition, they send pictures and they say, I need 4,000 grafts, and the other clinic is offering me this much of price, and they are saying they'll do FUT or FUE or whatever, or maybe a combo. I have made a video on this, and again I am repeating, there are three different things. One, how many grafts do you need to fill the area, the bald area? Then second is, how many grafts can be extracted from your donor area? And third is, how many grafts can be placed in that area, in the empty area? So again, how many grafts do you actually need to give a camouflage? There is no end to it. We can place double the number, or maybe sometimes triple the number, but it is up to you whether you want to use your entire donor in a limited portion, or you want to keep it safe for the future. For those who don't know this, I am repeating again, hair transplant results are not permanent. There is something which we are, it's a continuous problem which we are dealing with. Hair loss cannot be completely static or stagnant in everybody. There are cases where it can be, but in most of the cases it is progressive. It can be slowly progressive, but it is progressive. So in those cases, we will be needing some transplantation, some donor area to cover the freshly bald areas. But where are we going to get it from? From your donor. And you are not born with an unlimited supply of donor. You must pay attention to this. I have made so many videos on this. If you haven't watched this video, go through the video. The link is given. Hair transplant results are not permanent. Please go through this video. Please get your facts correct, because many a times people coming to me for repair transplants, and these people include doctors as well. They sometimes think that if they take out the donor, take out the grafts from donor, the donor remains more or less the same. There is no depletion. That is how things are shown to you. Again, I am repeating this. The cases which you see on internet, suppose if a clinic is doing 1,000 cases, they will show you only maybe 20, maybe 15. What about the rest? Where are they going? What is happening to them? Nobody talks about that. See, the cases which are shown to you, they are the cases with exceptional donor. Even if you take out the grafts, there won't be many gaps visible. And what you are seeing in that guy after extraction of hair, you might not be having, half the number even in a fresh case. And I regularly come across such queries where patients say, sir, we need 4,000 grafts. Particular clinic has quoted me a price, FUT and FUE combo and all. And when I examine those patients, just by looking at the pictures of their donor, I can make out that in these patients it is not possible to extract even 2,000 by combination. But they have been told, not by one clinic, not by two clinic, by hundreds of clinic, not only in India, across the globe. Now, when this happens, somebody asked Hitler that how do you manage to manipulate people of Germany? They are like educated, and you are manipulating them so nicely. So he said, I propagate whatever I have to propagate. I just repeat it 100 times, and it is perceived as truth. So please be aware. Don't fall prey to such tactics. It is your right to understand, to know each and every fact. Even if you think you are the smartest person on this planet, even if you think you have talked to the best doctors on this planet, even if you think you have done one of the best researches regarding hair restoration, but still there could be something which you are missing out. I think hair is so important for you. You won't like to miss out on those facts which are there in public domain, which people know, which you later on might repent. Why didn't you, understand this? Why didn't you realize this, or why didn't you hear this earlier? So if you are listening to this video, if you just stumbled upon this video by chance, consider yourself lucky. You have just hit a jackpot. Okay, because this information is very crucial, and the links which I have given, go through those videos. There are videos regarding the density of transplantation. There are videos about difference between FUT and FUE, the longevity of procedure. There are videos about permanent donor zone, non-permanent donor zone, unsafe donor zone. There are videos about body hair transplantation. There are videos, everything is there. So go through the videos, you will understand these facts better, and these videos will help you to take a correct decision. I realize one fact, I cannot do transplant for everybody. Each one of you who is listening to this video, obviously I cannot do transplants for all of you. But yes, I am here, and I am here to, reveal the truths. I am here to share my experience, and I am here to share my unbiased experience with you guys. And this is like almost the gist of 20 years of my practice. And the reason why I'm making these videos is the kind of unawareness, the kind of misinformation and misrepresentation of facts which is being done these days, and the patients who come to me for repair transplants, when I ask them about the maintenance of their transplant results, or why did they choose a particular method, hardly know anything. And that is so disappointing, because you are trusting on somebody, you are giving your head to somebody without even knowing the truth. So it's my humble request, please, even if you think you know everything, go through these videos and you will definitely come to know about the real facts of hair restoration. Okay, just a small note on FUT and FUE. Both the methods are actually very good, and both the methods complement each other. Suppose if you have a toolkit, okay, and there are so many nuts and bolts in that toolkit, you might be using something for most of the times, but in a particular situation you might need the one which you haven't used at all. But what will happen when that situation arises, when that case comes? You won't be able to handle it. But obviously for this patient, this is going to ruin the things. So it is always better to go to a doctor, at least for honest opinion, what is good for me, consult FUT or FUE, and then you can take your call. Now I receive a lot of calls from my patients, and a lot of thanks calls. They say, doctor, we haven't seen you, we haven't met you, but because of your videos, the information you have told us, when we go to some clinics, and we have an idea, and it really helps us to differentiate between a fake clinic and a good clinic. And I'm really happy that this is happening, and this is the reason exactly why I was so keen, I'm so keen to make these videos. So I think that's it for the day. And if you have any questions, if you want me to make videos on any particular topic, if you have doubts about it, please don't hesitate. You can ask in comment section, you can call us on given numbers, you can WhatsApp us, you can mail us at the given mail ID. For detailed information, you can go to our website and see a number of cases, and a lot of information is there also. And if you have already got a transplant done, and if you are not getting enough support from your clinics, we are here to help. No problem, you can contact my team, will help you. We receive a lot of queries about medications and all, and we try to answer as many as possible. And sometimes it is not possible to answer all of them, but we definitely try to do that, and sometimes the answers might be little delayed, but don't worry, we will answer all your questions, all your queries. And even if you need a friendly advice about your procedures and everything, you can't come and travel, especially during this corona period, my team is there to help you out, so don't worry. I'll keep making these videos, and if you like the videos, please press the like button and share this with all your friends who might need it. If you are lucky, you have got this information, I think it's your duty now to share this with your friends, because not everybody has watched these videos. People come and say, "Doctor, had I watched these videos earlier, I won't have been looted." So again, thanks a lot for watching the video till end, and thank you so much. Please do take care, and if you haven't subscribed the channel, subscribe it, and don't forget to press the bell icon to receive all the notifications. Thank you. Love yourself. Stay blessed.